Hi guys, welcome back to HAG Studios. Today I'm back with Dr. Adrian Mitchell, obstetrician gynecologist. And so you know we're going to be talking some more about women's health. So stay with us. So, Dr. Adrian, welcome back.
Thanks for having me. Thanks.
Okay. In our last episode, we focused mainly on concerns of the younger woman. In this episode, I think we want to look more at the concerns of women are a little older, maybe middle age to older women, and how changes affect women in this age group.
Okay, we can do that today.
So you tell me what are some of the main things that concerns that women who are older come to you about?
Well, when we say older, we should be very kind and say what we consider old. I mean, I think 50 is young. I think 60 is still young.
Me too.
I remind people that, you know, if I see you now at 40 and then I see you at 70 and you're complaining that you're old at that time, would you say that you're older now at 70 or you're younger now? So, or you're younger then? Mm-hmm. So, I mean, you know, to highlight, I think we're talking about a lot of women in their reproductive years.
Yes.
In the last episode, I think,
right.
You know, what happens after you're coming out of the phase of reproduction. You've completed your family. You have met the person. You or you have reached a point where you may not have considered a family, but you're moving out of that area where your cycles are not regular anymore, or you may be having other symptoms. Now, typically you find that in the 40s, in the 5th year of life for a lot of women, they do have changes.
5th decade.
5th decade, I should say, yes.
Yeah.
5th decade, not 5th year, eh? 5th decade.
Okay.
The biggest change that women tend to come into the office for is a missed cycle. With a missed cycle, it's going to be that period that didn't show up on time. So you think you're having a pregnancy scare, but you realize that I haven't been having sex that much, so it can't be a pregnancy. So what is going on? And normal women present with that. The aim of the doctor at that time is to reassure, remind them that, things are changing.
Yes.
And the things that are starting to change is the amount of estrogen and progesterone you're making. So because of that change, you're not going to have enough necessary to cause that drop in your hormones to say, okay, I'm going to have a cycle now. So you want to reassure the patient and say, hey, this is okay. You may
And that's usually around what age on average?
Maybe I say between 40, 45,
40, 45.
Yeah,
okay.
The earliest I've seen somebody present is maybe 35, 36.
Okay.
But 40, 45, you tend to get that change. So that's the number one reason I see patients coming and say, oh my God, what's going on? And then you have to gently ease in the topic. You're having changes.
Is that what is called perimenopause?
Well, a missed cycle is not perimenopause. Perimenopausal symptoms or the perimenopausal period is just around the time when you're about to hit menopause.
Okay.
And you do have other symptoms that kind of add to that topic that says you're perimenopausal. So having a missed cycle once is not perimenopausal, but having it 2, 3, 4 times for the year, you may consider that something is going on.
Okay. And
you want to rule out other causes of a missed cycle or other causes of a period going absent before you can say, oh my God, you're perimenopausal.
Okay.
And that will be in a discussion with your doctor. You can do blood tests, you can do ultrasounds. There are a couple of investigations you'll do.
What would you want to be ruling out? I mean, apart from pregnancy, what else could be?
Well, I wouldn't rule that out. I want to rule that in. but the big thing that happens in our population is going to be patients who present with polycystic ovarian syndrome. Now, that can present from as early as teens all the way up into your late 30s, maybe 40s. So you want to look for that because that tends to be one of the main causes for a patient's cycle to behave out of the norm. And I use that term behave because you can have early bleeds, you can have later bleeds, or you can have no bleed. So that's one of the main ones we want to really
So
look
what
for.
is that really?
Good. So polycystic ovarian syndrome is in layman terms, hormone imbalance, if you want to say.
Okay.
But there are criteria that you, as a physician, would use to put a patient in that territory to say, oh my God, you're on the spectrum or you have the diagnosis. I won't bore the audience with that, but that's something that your doctor can educate and tell you about. But you do use blood tests. You do use the patient's history in terms of what's happening with them. And you do use radiological investigations. And the main one we tend to jump to is a pelvic ultrasound. That kind of gives us an idea what's going on with the architecture of the ovaries. And while we're looking at the architecture of the ovaries, we also want to look at the architecture of the uterus, because there are other things that can cause a cycle to go haywire, such as a little baby boy inside, you know?
Okay.
But yeah.
What do middle age? You said don't use old.
No.
All right. What?
You know,
what's the word you want me to use?
Let's talk on old. I don't like old, you know.
Okay.
Because when let me tell you why. When I was young, I would say, boy, you know, anybody at my age was old.
Okay.
I don't think I'm old.
Okay.
I might be 35, but I don't think I'm old.
Okay.
So I like to tell women, you know, as you age, as you grow, as you mature, as you blossom. To your third, fourth,
or bloom,
your fifth blossom, or fifth bloom. You know, there's some changes that you may want to talk to your doctor about, and the typical things you may hear women talking about is hair loss.
Oh,
women
really?
come in for hair loss.
Come to you about hair loss?
They ask about it. I mean, we do include our friends, the dermatologists, to help us along.
Yes.
You do have hair specialists or dermatologists who specialize in hair loss,
right?
Who do a very good job of helping patients. But that's another thing. They come and they say, "Doc, my hair thinning out. What do you expect? What I must do?" Now, sometimes simple supplementals can help, because you do find your nutritional retention and the value in your diet is no longer being compensated by what you're eating, because you find that as you progress a little older, your diet now changes. What you may want to eat changes. So certain nutrients you're not getting anymore. Okay. And then you find also some patients will talk about the famous one, which is, I just had a child and I'm having hair loss now. So, you know, or I'm having hair loss a year or two later. What's going on? You know, I used to have this thick, fluffy hair and now it's thinning out.
Okay.
So that comes into hair growth. You know, how you give nutrients to the hair, whether it's going to be certain oils you're going to use, supplements you're going to use, and also, you know, looking into kind of how you care the hair. So that's another thing patients tend to show up and be like, you know, I know you're not a hair person, but you're my doctor. I'm having these changes along with my period going off. What's going on?
Okay. What else is common?
A change in your mood. You know, you find that patients come and say, you know, they are realizing that they may have a little bit more of a shorter tempo. They get into a lot more, you know, confrontations or arguments, or they feel a lot more miserable or even down, you know, a little sad. And that goes back into the hormones, you know, what's changing with a woman's hormone during that time. So, you know, you find patients come in and say, boy, doc, these are happening. What do you think? And that does add to know the perimenopausal group of symptoms that you may want to discuss and say, okay, this may be happening. The famous one is hot flashes. Everybody is afraid of it. I think whether you're young, old, or elderly.
But is that peri or that is actual menopause?
You have patients who can show up with some hot flashes, like the period goes absent for 3-4 months and they're having hot flashes in between, but then the period shows up and they feel normal. They're like, oh my god, thank you. They come back. You know, so you do have some degree of hot flashes. You know, they're in a room, they're sweating a lot, the AC is kicking, or they're out in the sun hot and they're shivering and they're like, doc, I think I'm sick. And you know, when you explore the history a little bit,
they shiver as well.
Yeah, they do get extremes. I know
about the hot flashes.
I had a patient who, it was last year summer, and outside is pelping hot, and this woman is saying, doc, it's so cold, and I'm wondering if something wrong with me, because I see people sweating and I'm not. And you know, we explored a little bit and we realized that, you know, the period was going to come to an end very soon. So we spoke about that and we helped her along.
Okay. Tell me something. What percentage of women have hot flashes?
Wow.
And the next question I'm going to ask you is, how long do these hot flashes last?
All right, so the hot flashes tend to come on closer, maybe a year or two from the onset of menopause, and it's not every woman is going to have it. You may find maybe a third of them will have it.
Oh, it's just about a third.
Maybe a third. You don't find every woman is going to sit down and say, I do have hot flashes.
Yeah.
But you do. But it's something that's common enough that you will find it presenting to the office a lot. And as I would say, again, hot flash is just one of the symptoms of the perimenopausal period, and also one of the symptoms that menopause is on the rise. So hot flashes is pretty common.
And for those who have hot flashes, how long do they last? Do they last forever? Or?
Oh wow! Some women get it prior to menopause, and then even up to a year, 2 years, they still have the hot flashes. I've seen patients even 5 years after still having the hot flashes.
Okay.
There is no way to predict which woman will have hot flashes long enough. That's why the relationship with your doctor, the rapport that you have, the yearly visits, the communication, saying what you have, can allow the doctor to interject and give supportive therapy to kind of help with the hot flashes.
Is there anything that's hereditary about it? If your mother had it?
Well, yes, you can argue that if it's in the family line, there's a chance you may get it a higher chance. But your patients who their mother never had any problems going through menopause and they're going through menopause rough. So it's hard to predict, I would say, overall.
Tell me, what are some of the changes that take place as a woman gets older, and especially in relation to changes re her vagina?
Well, when we're talking about changes in a woman, we have to take in the entire picture. What happens mentally, what happens with the physical, what happens emotionally, what happens in our day-to-day life. So the first thing when you have changes as the hormones switch up in a woman's body and they tend to complain is their discharge. So they notice that they're not as wet as much anymore, or the color of the discharge changes. It's not as creamy, it's now a lot clearer, or there's none. So you find that with the changes in amount of vaginal secretions you make, some women actually may get a lot more bruising in sex, they may get spotting in sex, because now the walls of the vagina are a lot thinner, they would say. The walls in the vagina are no longer producing a lot more mucus. The cervix is not producing a lot more mucus. You find that the Bartholin's gland, or that gland that's responsible for moistening the entrance of the vagina, is no longer working. And that now changes what happens in sex. So at this point, we have the conversation about sex and what do we introduce in terms of lubrication for the vagina. Now, I will say up front, I'm not paid by any company to promote any type of lubricant, but I'm not a fan of KY gel. A lot of women should burst the bubble on KY gel. It is not good as it's made out to seem. I think KY gel is a good professional lubricant when you're examining a patient, but for personal use, I don't think it's good. There's another one that I tend to recommend, and I will call the name. I'm not being paid by them, I don't care. And you have to purchase it for us in Jamaica online. It's called Astroglide. It works wonders. And I find that it mimics
our audience is not just in Jamaica though.
Well, there you go. Technology. It works wonders in terms of actually mimicking the vaginal discharge, and you don't need too much to go for long. So you find that KY gel, also patients say, boy, it just evaporates. The Astroglide, I find, hangs around a lot longer. And it tends to feel a lot better for both the male and the female. So the vaginal discharge, secretion, the changes in sex, can affect a woman and make her feel, wow, am I really getting to that middle age point? Am I really getting to the point of perimenopause or menopause? But we've ignored the fact about the psyche that affects a woman and our confidence. And we have to remind women that the beauty about blooming in that 5th year of life is that these changes are to be welcomed. There are a lot of things women can do to welcome these changes. Having a good workout, exercising, vitamins. I like to recommend evening primrose oil and black cohosh. Works really well in helping a woman to maintain that hormonal milieu. I like to tell patients to talk to other patients about it, because feeling alone and feeling like it's only you one going through that moment.
It's not discussed enough.
And it's not, it should be more round tabletop talks like this that make women feel normal. What to do, because you'll be surprised that a lot of women you brush shoulders with are struggling with these things and they don't have a voice, and sometimes venting, feeling normal and realizing that this is normal is more welcoming. And when you welcome it, you're okay with the fact, oh, I may have a little dryness, it's fine, rather than, oh, I don't have this wetness anymore. So, it's kind of adjusting, dancing with it, and also embracing it, The other thing that...
A lot of women are happy when the period is finished,
Yeah, I mean, heart goes out to them. Having it come every month is a bit rough. When Aunt Flo stops visiting, I can imagine all are happy. But here's the next thing. what happens in the marriage? What happens when I no longer have that desire for sex from my partner? You know, your husband is ready, rearing, and you're just like, no, not today, not next month, not next year. How about we just take a break? You know, and you want to remind women that yes, you know, sex is a functional part of a healthy marriage, but there are other things you can do in the bedroom to please your partner and please yourself. And also it's for the partners to adjust to this, because you find that nothing is necessarily wrong with a woman. It's kind of how you approach a situation that you can get them to that point where they're now comfortable and you can get them better aroused. So the same thing that you may do for your partner when she's 20 is not the same thing you're going to do for her when she's about 40. The same thing you're going to do when she's 60. So there has to be a change in the behavioral pattern in the bedroom, and that conversation now has to happen with the partner in the room so we can explore a little bit. It's a sensitive one. Not all the patients are going to come forward and say immediately, but it's something based on a rapport the doctor has with the patient to broach the conversation. How do you go about that? And I can tell you, some of the patients that I have who are middle-aged, who explain to me about their sexual changes, you know, we have a very healthy discussion, and they're a lot more happier having a male gynecologist to say, boy, you know, this is happening. How do I know, you know, help in the bedroom? And I say, well, these are the things that you should do. They go home, they try it, and they come back big smile. Boy, it work, you know, but you have to go fix something else. I think you might have tear something, you know. So you find that the conversation needs to happen a bit more regular, because doing that now echoes back to the confidence in a woman about her changes and welcoming those changes and
but
embracing
aren't the
it.
men going through changes at that time as well?
I will say this, the reason why I started gynecology and not urology, I have to take that up with the urologist.
Yes, I know, we will do that. But
I have not been any degree of professional input in a man's life in a good amount of years. So I like to say, men, when you find the answer, come check me to a year. But I can't say. I mean,
well, we will be talking with Dr. Aiken about
Lovely
men's health.
yeah.
So that's something we will bring up with him.
So you want to stay away from fast foods. That's a very important thing. And you want to eat clean. So you find doing a lot more home prep meals, eating healthy at home is going to go a further way in terms of your nutrition and your health. And also taking your supplements and vitamins.
Yeah.
So you want to make sure that that kind of package is there. And you find that doing that makes a better impact on how your hormones change during that period where things are happening.
Do you have any advice to men on how they can work with the women where these changes are concerned? What can they do to help?
Well, you know, there are a lot of things that men can do to support women, but I like to encourage my patients that, you know, self-care, self-love goes a further way than giving somebody a directive. So I encourage my patients, you know, accept your changes, adjust to your changes, and then teach them how to adjust to the changes. Now, the catch-22 behind that is that doesn't mean they're going to accept it. But once you have set a certain criteria how to engage in terms of when you're having a irritable time and you notice your hormones are changing and your husband is saying, boy, I need this and that, and you're not listening, you can say, hon, I'm not having a good day today. I'm feeling a bit flustered and I'd like a break. You know, those simple terms of communications go a further way. And if he does ask why, you wish to explain why, he said, boy, I went to the doctor and my hormones are changing, so a lot will happen from time to time. You know, being able to communicate and have that line of communication goes a further way in encouraging the partner to accept it, because now you're giving a reason for it versus not saying anything or just acting out. It goes into the next topic. What happens if a woman has a hot flash and she's not feeling so well? You can say you're driving on the road and your husband has the AC on cold and you're feeling extra hot and you're like, boy, turn it up a little bit. He's like, it's already cold. You can explain to him at the time, say, boy, honey, I'm going through some hormonal changes. I'd really appreciate if you could even wind down the window some more so I can catch some more fresh air, because my hormones are really going out of whack now and I'm really feeling hot, even though you're feeling cold. So that line of communication is going to be important in engaging your spouse to kind of accept what's going on and understand what's going on. And when you find that patients kind of open that line of communications, you know, they tend to have a better acceptance period with the man, because now they have a reason to say, okay, I I will now understand what's going on. But men are men. I mean, sometimes we don't listen and we don't want to understand. But I mean, I encourage our patients to communicate.
Do you have any advice for women who are having sex after menopause and maybe even long after menopause? Are a lot of women having sex in their 70s and 80s? Do you know?
All right, so, women having sex, after menopause is common. As to when someone's sex life stops, it varies. I have patients in my office at 85 still having sex with their partner.
Okay.
Because women at 85 maybe having a 50-year-old husband, and that 50-year-old husband is still wanting to have sex. So, I mean, the topic of, when does sex end? Sex ends when a woman decides she wants to stop having sex, but it can stretch as far as they want to. And the tips that I normally like to give patients is going to be communication. Because what a woman wants at a certain age is not going to be what she would have wanted when she was younger. So that's the first thing you want to do, communicate very effectively, nice, gentle with your spouse. And then the next big one is lubrication. After menopause, you find that your vaginal discharge is not going to be as much of a help with lubrication. So you want to get some lubrication in the bedroom. And by that, you're going to have a lot less issues and have sex being a lot more enjoyable.
Okay. But are there women who don't have this need for the lubrication?
Very few.
Very few.
Very few.
Oh, okay.
Very few.
Okay.
Very few. Very few. So that need for lubrication is more than the very few that will say are lucky.
Oh, okay. Okay. Is it possible to go through menopause and not have any of these symptoms?
Yes, you can just realize that 2-3 years have passed, you haven't seen your period, and you're quite happy, you're quite fine. And
or you have a hysterectomy and...
Well, that's true. I mean, but I would say having a hysterectomy just will be the absence of the period, because some people have a hysterectomy and still have menopausal symptoms.
Okay.
So, I mean, it's kind of luck of the draw. If you're one of the women who have been blessed not to have any symptoms, count yourself very lucky.
Okay, and that's a small percentage?
Yeah, I would say some women have some degree of symptoms, whether it's going to be an absent period, a skip period, miss cycle, or it's going to be hot flashes, it's going to be irritability, mood changes, fluctuations in personality. Yes, so I mean...
And some people have all of them.
Sadly so, yes.
Okay. Yeah.
So I mean, the take-home message behind it is that, that middle-age period of a woman's life, or as we would say, our message is the fifth blooming of a woman's life. Is something that you want to welcome. Fifth or sixth blooming is something you want to welcome. Something that your doctor can help you through, and you want to open that line of communication from early and explain to your doctor the changes you're having, so you can know adjust as the change is happening. And once you go through that period of adjusting along with your doctor, getting supportive therapy, certain things changing such as how you eat, your diet, you find that the symptoms that will come on, you'll be able to manage a lot better.
Okay.
And there's nothing wrong with it. It's a part of life. It's a beautiful thing also to go through, but with support.
Okay, Dr. Adrian, you have anything else you want to add? Any encouraging words for women who are blooming? Well, in the 50s, 60s, and even higher?
The first thing that I'm going to say is, welcome the changes.
Yes.
Accept it for yourself first. Once you have accepted, your small group around you, you're going to be able to communicate with them effectively for them to adjust their behavior to you. The most important thing during this period is also to keep a good dialogue and relationship with your gynecologist, because there are other reasons why you may have any symptoms and not just menopause, and you want to ensure that you rule them out. So that kind of conversation segues into other topics we should not go into, but just make sure you go for yearly visits with your doctor. And it's a good thing. Welcome it, embrace it, exercise, eat well, and just dance.
And women could talk more openly among themselves, don't you think? Do you? I sense that people tend to keep those things to themselves. Yeah. And we should be having more open discussions, you know,
Yep.
and realizing that we probably all sharing the same things.
I agree. I agree. You know, that goes into other areas that, you know, community-based
Yes.
topics that should be more open, or forums that should be more open. I think this is a good start, you know.
Yes.
This type of information being available for free to the public is a good start.
Yeah.
You know, having the comments page. Maybe somebody will start a support group, a club for it.
Right.
But I agree. It's something that's lacking.
And they will put in the comments other things that they might want to ask.
There you go. But I think it's a great start and a great forum for it. But
Okay.
it's a good thing.
All right. Thank you so much, Dr. Adrian. It was really a pleasure talking with you again, and all the information you gave us will hopefully make a lot of difference to our viewers.
Well, thanks for having me again. It's always a pleasure and an honor. And I look forward to discussing more of these topical issues with you.
Okay.
Well, thanks for having me, and cheers to the audience. Bless you.
On What's Growing in My Garden today, we show you pictures from one of our faithful followers, Norca, and she lives in Florida.